Hello, welcome to this event, The People Behind Healthcare Innovation. We'll get started in a minute and let people convene. Great, let's get going. Welcome, everyone. Welcome, Peter Ohnemus. It's a great pleasure to have you here today as part of the People Behind Healthcare Innovation in our series of Health Tech CEO Fireside Chats. I'm very excited to catch up, talk a bit about yourself, a bit about dacadoo, what you've been doing in the last 2 or 3 years. And yeah, without further ado, I just want to say to the participants, if you've got questions that you would like to ask Peter, feel free to put them in the chat, and I'll have a look. I'll pick them up, and yeah, off we go. I'm Tobias Silberzahn. I'm your host, and I'm leading the Global Health Tech Network, a community of a bit more than 1,000 health tech companies at the quarterly Health Tech CEO Roundtables. And as part of that, I'm happy to bring you some of the exciting CEOs and health tech companies from the Health Tech Network. Peter, why don't we get started a bit with your personal journey? Could you say a bit about yourself? How did you become a healthcare innovator?
Yeah, thank you so much, first of all, to have me today. And thank you so much for the people who are joining and listening in. So I actually started out programming databases, and I sold my company to Sybase. Sybase became a very large software company in the database industry. So I was always interested in the data. And then when I turned 40, I decided that I wanted to spend the rest of my life making a difference and really meaning it. So I founded the world's first sustainability rating agency together with Goldman Sachs, and became quite successful with that, called Asset 4. And then in end of 2009, I sold that to Thomson Reuters in New York. And I thought, if you can do sustainability rating of a public quoted company, looking at its energy usage, emissions, etc., you could create a health score model for human mankind. I contacted one of my very good friends who was a professor at MIT, and told him I wanted to create a global health score, a holistic view of health, and he declared me crazy. And when a famous, intelligent professor declares you crazy, either you are crazy or you hopefully have a good idea. So I thought that I choose the second way. And yeah, so we started in 2010, and we thought we need to find a baseline of health. So we spent 5 years. We were like a biotech company, spent 5 years researching data around what is health, how do you define health in a holistic view. So it's really an academic validated health score that we created.
Mm-hmm. Can you say us a little bit more what goes into the health score?
Yeah, so basically when we started looking around, we were like, it needs to provide the complete view of your life. So we said, let's build it on 3 pillars. So we said it's consisting of your biological data, so what you consist of, your blood pressure, your blood values, etc. Secondly, how do you feel? So we men are not so good in this, but we believe that mental is very important here at dacadoo. And thirdly, how do you live? And Da Vinci, as you remember the drawing with the arms and the legs, he defined that model 530 years ago. But we said, let's really underline it and document it in a very serious way. So basically today we have scored over 300 million man years of clinical data, and we have very deep modeling. So we first we wanted to make sure that it was academic correct. So we founded an academic validation board that validates all our model. So they are leading medical experts around the world. And at the same time, we wanted to make sure that the consumer could understand it. So there was a very famous British professor about 180 years ago who said, what you can understand, you can improve. So we said, let's create a health score, which is a proxy of your life. Let's make it a number from 1 to 1,000. And many people ask me, why not 1 to 10 or 1 to 100? Because your life is very broad, and Tobias' health is not Peter's health, etc. So we wanted to have something people could understand. And we felt that number was good. People understand. If I tell you today I'm 56 years of age, you can, imagine how it feels to be 56 years old. So today when somebody, it was funny, I was actually at the BMW museum speaking lately, and then there came up a German CEO and he said, you're the dacadoo guy. My health score is 630. It was the first thing he told me. I didn't even know the guy. Yeah. And that I thought was quite fascinating. So if you wake up one morning in Singapore and you see your health score is 400, but everybody else in Singapore has a health score of 590, maybe you should look a bit after yourself. So the whole idea is what you can understand, you can improve. The second thought, which I think you will find interesting, is we were convinced, and this is already over 10 years ago, there was no Apple Watch, as you may recall, and people couldn't spell, the word tracking. We said it has to be passive. So we believe over the next few years that, your smartwatch and your sensors would be so powerful that it would automatically know your body temperature. It will know your rotation in bed. It will know, your heart rate. We even believe that we will have a constant glucose monitoring on biosensors. So we are just at the beginning of the journey of quantified health. We believe it will make people live longer and healthier. I don't necessarily want to be 120 years old, but as long as I'm here, I want to have a good life. And I think that should hopefully be the goal for most people.
Very interesting. When leading myself a health and well-being program in our company for the German-speaking colleagues, right? I look at different, I would call it my customer segments, right? There are some people that are more health focused, and there are other people who want to be maybe just happier or deal with stress in a productive way. So how do you think about, if we take a population and how do you think about using a score like that to then help people change their behavior in a sustainable way?
Yeah, it's an excellent question. There's not two people who have the same life. They're not two people who has the same biological buildup. So to give you an idea, we always think, if this one person eats an ice cream and another person eats an ice cream, that they burn the calories exactly the same way. That is even proven by leading academic research. That's not the case. So we are individuals, and that's what makes us beautiful. And as you said before, maybe somebody is a bit more serious of nature and somebody else is a bit more crazy and easygoing. So what is very important in lifestyle navigation, which we call it, one size fits all, doesn't work. So what we have done, if I may just explain, is we have built a rule-based engine. And this rule-based engine is using our science and machine learning to try to figure out what kind of individual am I dealing with. And as I said, it's still early days, but I personally believe if you give somebody a health score and you understand the underlying lifestyle and issues, you can try to help that person navigate through their health. So in our rule-based engine, we look at your sleep quality, we look at your mental well-being, We look at your biology situation, etc. And it's at the end of the day, the more data you get, the more prediction you can make. What is very important is dacadoo doesn't license any data to anyone. dacadoo doesn't sell data to anyone, and we don't do any advertising. So all of your data is encrypted with a 256 key, and all your data is belonging to you in your private container. So before GDPR even existed, you know, we were 100% GDPR compliant or HIPAA compliant. So it's about understanding your life and hopefully giving you, as you said before, a better and a healthier life.
Thank you. We just got a question from the audience. The question is, what parameters a wearable device should monitor in your view, Peter, and record that are essential for the dacadoo technology to work accurately?
Yeah, that's an excellent question. So when we started working on dacadoo 10 years ago, we worked with, as I said, professor from MIT. We also worked with a very famous German professor who is specialized in nanosensors, Professor Tröster at ETH. And we actually, I mean, we went way crazy. You know, we were tracking body temperature, heart rate, blood values. You know, I was sleeping every night with all different kind of sensors, but we wanted to see what parameters were, you know, giving the best outcome. So in today's world, I know that everybody knows you can count the steps. I think that's just the beginning of something that will become a lot more powerful. So we will, over the next few years, see real-time glucose monitoring, which is very important. Your body temperature, for instance, when you consume calories, your body temperature changes. The noise level around you is very important for stress. So we looked at, noise detection, meeting intervals. I mean, persons like yourself or myself are, running from meeting to meeting. And of course, let's be honest, this is not particularly good for a stress score. So to answer the question, I think we are early days. I think sensors will become very cheap. And we imagine in our models that very soon I can actually track all this at very low cost, including using picture recognition engines for blood testing, lack of vitamins, etc. So everybody on the call knows litmus test. So 10 years ago, we actually did modeling around how could I test my blood at home just using my smart camera with color indexing, etc. So suddenly you don't pay $120, but you pay maybe $2 or $5 for a litmus paper that has a chemical substance, and then you can do very fast and real-time blood analysis. So all these technologies are coming. Another technology, as you know, you have the finger rings. I have two of them here, which are just two of them. This, I think, also has a great potential. We are now seeing smart plaster. I put a chip in my shoulder last summer, and I was doing glucose tracking and looking at how well did my own body absorb different kind of meals, because there is a direct correlation between your microbiomes and your glucose absorption. So I hope that gives a little bit of answers of some of the ideas that we are occupied with.
Very interesting. Having some biohacking tendencies myself, I'm now curious, what did you find for you personally the most helpful sort of micro habit towards your health and well-being?
That's a great question. I don't know, when I was young, I was so looking up to the big famous CEOs. So I had this feeling I have to be tough and never sleep and work 24/7. And, I realized with all the biohacking that my blood values and my personal well-being is just so much better with sleep. And, you know, I was used to be a very, very competitive sports person. And actually in today's world, I would probably say a more balanced sport behavior and getting more sleep, at least for me, was, I would say, a big surprise, because I basically, as an entrepreneur, lived 30 years on way too little sleep. And since I try to get my sleep, I'm just more balanced and I'm a more pleasant person, and I think I have more energy. So for me, that was a big. I know it sounds logical, but it is not so logical, because, you know, you are raised and taught and educated in university, go for more, do this, do that, you know what I mean? And so, but each person is different.
Thank you. You said that dacadoo was started around 10, 11 years ago. What impact are you most proud of so far, Peter? And I understand you are on a longer journey, but if you look back the last 10, 11 years, what would that be?
Actually, proving the no-sayers that they were wrong. And when I founded the company, I was doing a round with classical VCs in the Valley, in Silicon Valley, and they all told me that this is never going to work, you know, and nobody will support you. And, you know, why would the insurances suddenly become digital? They have always been analog, and, you know, hospitals, they don't want this. And today, when I'm invited to speak at Stanford or, you know, Royal Institute of Medicine in England, actually people say, bravo, you didn't give up. You really invested, you know, massive amount of money, of your own money and your energy and your network. And to be honest, that's what makes me the most proud, is I proved them they were wrong.
Yeah. And you mentioned insurances. What I find interesting is that, you know, dacadoo with the digital health, the health score, the digital health engagement platform, right? You could look at dacadoo as a classical digital health company. And then on the other side, you're also very much thinking about sort of insurance, insurtech kind of things. Could you say a little bit more about that?
Yeah, absolutely. When we founded the company, we saw ourselves absolutely as a digital health company. And we actually started with a different name, which I think is funny for the people to listen to. So we called it Quintic. So a Q in the front and a Q at the end, which was a difficult company name to find, because we said it's going to be about questions and quality of life. So we wanted 2 Qs. And as we moved on and we started talking to, and we went to all the biggest, you know, Pfizer and Roche and all of them, we realized that they were not ultimately the ones that had the biggest pain. And I always believe when you build a company, you need to have a use case where you are solving, you know, serious pain. And then we realized, okay, the payers will move faster than the providers. Now, what is very interesting, I hope at least for today, is now we really start seeing the big healthcare chains getting very interested in dacadoo. So I can publicly share, we have closed now Falk. Falk is the largest private-owned healthcare group in Europe, owned by the Lego family. So we are their platform. We are the global platform for United Healthcare Group. So they are both, as you know, insurer and provider. We just, last year, we won Unimed Seguros in Brazil. That's the largest hospital chain in LATAM. They have over 400 hospitals and I think 125,000 doctors and nurses. So the pendulum, if you want to put it that way, is shifting. And I think overall, we are moving into an outcome-based health economy. And I think it was very interesting when we saw CVS acquiring Aetna. For me, this was such a logical move, because I was like, I think as computing power and medicine comes closer and closer to each other, I think payer and provider would also get closer to each other. So we were used to be that nobody understands medicine, nobody understands actuaries. But as we are moving into a digital economy, those borderlines are flowing closer to each other. And that was why I thought it was logical that CVS and Aetna was emerging, and it has done very well to the share price if you look at it. And going forward, I think you will be what I call an integrated operator. And you didn't even hear me use the word insurance or healthcare. So I think I wrote a paper last year around this integrated operator and trying to explain what I think is coming next in the healthcare sector.
Thank you. And, you mentioned a digital health engagement platform, right? That is sort of part towards the citizens or the users. Can you share a bit what's your learnings over the last years in terms of how to engage people on health related topics, how to keep them engaged? What are some of the things that you've tried, tested, and where you would say that this is actually part of your recipe?
Yeah. So you asked me before what I was proud of, and that was like what I said, proving people that digital health and outcome-based healthcare can work. What I'm, less proud of is how long it took us to find a model where you can actually engage people. And I realized that health is not a sprint, it's a marathon. And basically, what do I mean by that? You needed to find models where, on one hand side, which is the toughest challenge for all of us in digital health, is what I call trust. So if you think about it today, if I would get cancer tomorrow, I'm just talking about, let me call Mr. Smith, I would share every single data point with anyone to save my life. If I'm healthy, I'm kind of resilient to digital health. In particular in Germany, as you know, there's a lot of discussions right now with the next government, etc. So basically, when we look around the world, it's very different. We are very successful in Asia. In Asia, they have many countries with not so good healthcare. So people are really willing to share because they value getting a better advice. And so from each market on the engagement side, we call it gamification. And of course, it's not gaming in a sense of a computer gaming, but it's using behavioral economics for engaging people around their health. On studies that we have actually done together with McKinsey, we see that you can take out 25 to 30% on digital underwriting, dynamic pricing, integrated care systems. So there is an economic value proposition, and Cigna, which is one of our big clients, which is a big American health insurance company, they issued a paper together with The Economist, and I thought it was very powerful, and there was no vendor whatsoever behind it. And they were looking at the outcome-based health economy. And Cigna said for every single dollar you invest, and they even broke it down in programs and said, you can earn from $4 to $1 up all the way up in the mental area, 1 to 16, 1 to 19 or $20. What I'm getting at is, if you can get the people engaged, you will get better outcome. You will live longer. If we look at the latest study that AXA just presented at the European Health Insurance Conference, their chief medical officer said in Europe, we get 81 years of age. So he normalized men and women. And when we turn 64.2 years old on average, we all get one chronic disease. Of course, you cannot normalize men and women, and of course, you cannot normalize chronic diseases. But this is, I think, a very interesting fact. So we actually spend nearly 1/5 of our life in chronic diseases. And that, of course, has very big implications from the cost sector. And we haven't even seen the baby boomers coming in yet. So in my eyes, the healthcare system we built around Otto von Bismarck's Krankenkasse or health insurance 150 years ago, it needs a serious review. You see in England that you have 4.2 million people waiting to get a treatment at an, as a National Health Services hospital, etc. So there are real evidence out there that we need digital health and that we need a more efficient healthcare system.
Very interesting. I would love to dive in now at length into the digital health competency topic, since the WHO always does this interesting cross-country comparison where do different countries stand on digital health competency, and my home country came in last when I just saw the results last week. On the other hand, I also wanna ask you a bit, how do you see the next 10 years or maybe more of health and well-being? How do you see that evolve? So maybe I'll just give you the task of answering a combination of both questions in the last 2 minutes, if that's okay, Peter. So on the one hand, sort of digital health competency, right? And what's your thoughts that my home country maybe could improve a bit on digital health competency, and how do you see the next 10 years of healthcare, or rather health and well-being more broadly?
Yeah, I will answer really fast. So Grandview Research in New York made a study on digital health. I cannot prove if they're right or wrong. They said that it will grow from this year about $26 billion in revenue to $237 billion over the next 6 to 7 years. So number one, it's the fastest growing industry in the world. We saw, when I founded dacadoo in 2010, it was less than $1 billion in venture capital. This year, we're going to go way over 20 billion. So over 10 years, a 20-fold increase. I always said that venture capital, you can hate or love venture capitalists, but at the end of the day, it's a great proxy of what's coming. Coming back to your question, I believe there will not be any future healthcare system that will survive, and the way that I mean it, without digitalization. Today, I unfortunately had a ski accident last year. I had to go to different doctors, and I broke my leg and my shoulder, etc. And my data was stored in all different kind of databases, no standard format, no sharing of data, etc. And that will not survive. So to answer your question, I believe FHIR, which is the data format in health, will become the global standard. It will do what HTML did to the internet, so an explosion. Number two, I believe sensors will become massively cheap. According to McKinsey, we have 470 million biosensors out there now. And in our view and discussions with Gartner Group, that's going to grow tenfold over the next 5 years. And last but not least, I believe that medicine and data is coming closer and closer. I call it quant. You can call it whatever you want. But imagine if we wouldn't have had the computing power we have today and COVID came. I can promise you hundreds of millions of people would have been dead. If COVID would have hit 20 years ago, you and I would be sitting here today with very, very bad numbers. And I think it's fantastic how digitalization, research, and medicine with the COVID vaccine has shown what they are capable of. And a lot of this encapsulation technology you will see in cancer research, you will see it in heart medicine, etc. So we were fiddling around for many years, and now I think we're going to take this leapfrog forward with the digitalization of the healthcare system, with digitalization of research, and this is going to bring enormous wealth to society and health to society. And just to close off, I just read a study today from UBS where they interviewed their clients, and it was astonishing. 90% of all UBS clients said that they would pay serious money if they could live 10 years longer, healthier. The second question, UBS, 90%. Ask them, how much of your wealth would you give? And it was 40%. So that shows you how human, we all know we cannot take the money with us when we go. And it also shows you we all want a quality of life, a good life, a healthy life. And that's why we founded dacadoo.
Thank you. Great final words. And for our listeners, there were a few questions in the chat that we didn't manage to get into the half an hour. If you like, you can engage with Peter on the group Health Tech Network and Friends on the HIMSS Accelerate platform. So there we can continue the discussion. With that, I say thank you, Peter. It was great to catch up again, and great to talk about how you think about health and well-being. And I say thank you to our hosts at HIMSS Accelerate for having us, and wish everyone a great weekend.
Yeah, thank you, everybody. And thank you for listening in. And thank you, Tobias, for investing the time with me. I really appreciate it. I wish everybody a great weekend. Bye for now.
Thank you. Bye-bye.